Following your total hip replacement, we will go through some exercises with you on the ward. We will give you an exercise sheet. We will be expecting you to continue the exercises independently on the ward and when you're discharged from the inpatient setting. This will ensure that you get the best outcome from your joint. So the first exercise is foot pumps. This is aimed at increasing the circulation in your lower limb and stretching out the muscles in the leg. Just moving the foot backwards and forwards. Quite a comfortable exercise. The next exercise is a static quad. For this exercise, you pull your toes back towards you, tighten the muscle in your thigh, lock your knee out and push your heel away. Hold for 5 seconds and relax. One more time for me. Pull your toes back, tighten the muscles, lock your knee out and push your heel away for 5, 4, 3, 2, 1 and relax. The next exercise is an unarranged quad. For this exercise, get a rolled up towel, place it under the knee of your operated leg. From that position there, pull your toes back towards you, tighten the muscles in your thigh and raise your heel. Hold it for 5, 4, 3, 2, 1 and relax back down. And again, pull back, raise, tighten and hold for 5, 4, 3, 2 and control it back down. The next exercise is just for range of movement, just to oil things up because you'll start to feel quite stiff. This exercise is best following your total hip replacement, either lay down on your back or sat in a chair. I want you to slide your heel up towards your bottom as far as it's comfortable and then relax it back down. When you're pulling your heel up, just make sure that you're not going past your 90-degree bend at the hip and relax it back down. This next exercise is bridging. For this exercise, draw your heels up towards your bottom. From this position here, I want you to tighten the muscles in your bottom and lift your bottom up off the bed. Hold it there for 5, 4, 3, 2, 1 and relax back down. Okay, one more go for me. Tighten, lift, hold for 5, 4, 3, 2, 1 and relax. If you have any pre-existing neck problems or back problems, maybe you just need to be a little bit careful with this exercise. If you're struggling to lift your bottom up off the bed, don't worry. Not everyone can to begin with. Just tightening the muscles and the sheer effort of trying means that you're working those muscles in your bottom. The next exercise is abduction in lying. Abduction means to take away. What we're going to get you to do is to move your operated leg out to the side so that you don't have any friction from the bedclothes. Pop a plastic bag underneath your heel. From the starting position of neutral, I want you to slide your heel out towards the edge of the bed and bring it back in again. A nice slow, controlled movement. The important thing with this exercise is that you keep your toes pointing to the ceiling. Don't let them rotate outwards. Out and back into midline and relax. This next exercise is a progression of the previous exercise, so this is hip abduction in standing. Stand with yourself supported by a worktop in the kitchen, in the bathroom, holding on to something so that you're nice and secure. From this position here, I want you to bring your leg out to the side and bring it back in again. A nice slow, controlled movement, keeping your toes moving, pointing forwards. And relax. And your final exercise is extension of the hip in standing. Again, holding on to something so that you keep yourself balanced. You stand on your unoperated leg and you take your operated leg backwards, tightening the muscles in your bottom as you do, and relax. And again, take the leg back, standing up nice and tall, and relax. Ideally, I'd like you to repeat these exercises 3 to 4 times a day. Breakfast, lunch, dinner and supper. 10 repetitions of each is what we are asking, but if you can only manage to do 5, start off with 5 and gradually increase to 10 as your strength improves.